Stay ahead with Salam Media. This is Salam Media coming to you live from South Africa.
Welcome back. You tune into Inspired Afternoons with me, Maria Mia, and now it's time for our hashtag Kindness and Compassion segment. And the initiative of the South African National Women's Forum is, for me, epitomizes kindness and compassion in terms of the initiative, this support for those that have tested positive with the COVID virus. In just last week, once the second wave hit, there was a great need for support in terms of good nutritional health, especially soup. Many people who are self-isolating have indicated to me personally as well, they don't feel like eating. Just something liquidy or some nourishment that was in a liquid form would help, because heavy food or eating a meal like this, for some reason this time around with this particular strain, they don't have an appetite. And within, I think, 24 hours, Sister Hawa Patel, she's got this amazing way of just coordinating and handling logistics, and all the sisters involved who are related to the South African National Women's Forum, within 24 hours, they got together with overwhelming support, with people offering to make soup in different areas, and within 48 hours, they were all around the country. The soup initiative was already out there. I'm just gonna read this list that Sister Hava made, and I mean, she was amazing. I seen it within 24 hours. Then she had made this whole list here. We have Roshni in surrounding areas: Dadaville, Akon Park, Polokwane, Mayfair West, Lenasia, Northcliffe, London, Benoni, Springs, Marlborough and surrounding, Houghton and surround, Ridgeway, Ormonde, Winchester, Greenside, Northcliffe Extension, Florida, Durban, the various places in Durban, Nelspruit, Azadville, and this is the list I'm reading, but I think Sister Hava has updated the list 10 times over, with more sisters throughout the country coming together, contacting to Sister Hava to say, how can I get involved? I want to be part of the initiative. I want to serve and I want to help. So, Sister Hava, welcome to Inspired Afternoons here. And you've been busy now for this past week.
Walaikum salam. Jazakallah, Mariam. Always nice chatting with you about how we sisters get together with sisterhood just to help uplift humanity, bringing contentment to our own hearts. Alhamdulillah.
So tell me, how did this initiative come about, the support for the COVID positive patients or those that are self-isolating?
Okay, Mariam, let's reflect back during the first wave when COVID hit South Africa. And the only thing that we were directed or given advice to do was cover yourself, wear masks, and social distancing. And if you remember, alhamdulillah, masks became like an issue because we needed to get in quantities to distribute. And alhamdulillah, when we discussed this on our network group, all the towns got together. They reached out to people who had the skills to sew, and then they started making up masks, and communities came forward and gave fabrics and elastics, and we were able to distribute far and wide within our communities and outside to hospitals, to the poor, the needy. And that was the need, and that was our first step to protection. And alhamdulillah, the need for assistance then came slightly about food packs, meal packs, and that was because of sisters, old people, gentlemen that are alone, living on their own, or they have small children and they couldn't look after themselves. And it started off, I remember here also, when one of the sisters said, let's we do something it was in the Val, that for these ladies who are appealing for help to get something wholesome. And the soup was suggested as wholesome. It was liquid easy to digest, and with some rolls. And along came another sister and said, let's make some sunnah herbal meds, where they got together and ground a whole lot of ingredients, and they made sunnah packs. And word went out, and we had other sisters requesting from Lens and that can they have the pack? How are we going about it? And so we started in small quantities distributing for people who came, who contacted us regarding soup and the herbal packs. And that was just the first wave. It was being done, but in a very small way. But came the second wave, and the spread of the virus was so great. And it was not just attacking one person in the family, it was a few members, it was cousins, and there was the support from outside, like family members or within, became difficult. And that's when people started reaching out for more, and the need for request increased. And as a result, this discussion started happening on the network group. And then that's when I said, come, let's roll it out in all the town to make us available for people who don't know there are women out there. Because not only were people reaching out or requesting for soup packs, there were actually volunteers who were calling or WhatsApping to say, how can we help? And people who started wanting banking details to put in money, because I'm sure people are afraid to go out to help. There are very good Muslims out there. They want to help, but they are the COVID situation, they have, they age, but they want to give back. And the only way they could give back is financially. And alhamdulillah, with that strength, with the support of people around who are well wishers, who wanted to contribute to this good cause, this service blossomed in Gauteng and in KZN. In Cape Town, I'm appealing to more women's organizations to network with us, because we're getting people who want to help as volunteers, and there are people who need soup, but we need more people to come on board from the Cape Town side to help to prepare the soup packs and also to distribute. So currently, while we speak, by the end of each day, if you take all the KZN groups, the housing groups, they start collating their lists, and the list of who have requested soups or who have they have found out that got COVID, and then the groups start organizing whose turn it is, how they're going to distribute it the next day. And it is really like it's fulfilling to know that you, while Allah has given you health, alhamdulillah, that you are able to help others in need, because you don't know when it's your turn. And that is the circle of life. And the soup initiative with the sisterhood is so amazing. If I give you an instance, like yesterday, on the Roshni, the Var Muslim on chat, someone asked, there's someone in my family in Durban who's got COVID, and they need some help with soup. And all we had to do, someone else just posted the contact list of KZN, and it was sorted. Likewise, we had requests from there's certain suburbs in Joburg where there was no volunteers. And our network group, it's so amazing. You've seen, Mariam, the sisters, like in Mayfair, we have Colors of Hope, and we have H for You, and there was Crosby Ladies Forum. They've come together to help the surrounding areas that don't have people. I'm talking about areas where it's poverty stricken, where there are people, they don't know who to reach out to. So the soup is also not only going to people who are COVID patients, people who are alone, who are sick, who also need nourishment, are reaching out to say, I'm in this area, can people drop me off? So, alhamdulillah.
Yes, and Hava from Greenside, and I also want to just relate to you, as you've said. So I was contacted by a sister who actually was here from Cape Town. She was assisting her daughter who had been studying here, doing an internship at one of the hospitals here, and she had come here to help us sort out everything to move back to Cape Town. And in the interim, sadly, she tested positive, and she was isolating and not doing too well. And being from Cape Town, she had no support system here. And she actually called to tell me, and I could hear she was visibly tight chest. You could hear her nose. She was very, very clogged. And she said, she told me, you know what? I really need some assistance. I seen your number. I'm here. Well, she's just down the road from me, and she says, please, can you help me? And I told her, you know what? I'm here not only for the soup, but if you need, she even requested if we can arrange a mattress, because she's got the room and her husband sleeping in a couch, and it's a very small couch, so if we can arrange a mattress for him. and just support. And
Yeah,
Alhamdulillah, I
yeah.
was so pleased we could assist. We could assist her because imagine you're isolating, you're far from home, you're far from your support, far from your comfort zone. But that gesture of, there's a warm pot of soup, but not only soup, we managed to arrange meals for the daughter and the husband as well. Then I had a brother who was self-isolating, and I think he's living on his own. And he messaged to say he requires soup and he's positive and well in self-isolating. So the thing is, there's such a dire need, and you don't know the appreciation in the dua. And it is said that the dua of a person who's sick really it reaches Allah. And imagine that person now making dua for you. What more do you ask? Can we do this just for the pleasure of Allah and to serve Deen?
Mariam, there's so many cases like what you're saying. There were so many holiday makers in Durban as well, and they picked up the virus, and it made it so easier when people started asking. There are holiday makers who can help, and there the list went out, and the sisterhood. There was amazing to see that soup was delivered, and it's in this whole process. South African National Muslim Forum was not only focusing mass soups. There were things like the COVID pack. There were situations where we were doing the winter pack, where we were giving people comfort by giving in the rubs and whatever to go through the struggling through the sickness, during the winter period as well. So this is just the soup is one of the needs at the moment. Alhamdulillah, South Africa, many organizations, even the women's groups that are in the towns that are very remote, also they have contributed in their own small way by sending like items prepared. Like I'm talking about when it came to the mask and the COVID packs and things to neighboring towns to help people who were sickly, who were poor, who couldn't afford these luxuries, we would say we don't see. And Alhamdulillah, the response and the gratefulness coming from that just inspired and motivated the sisters countrywide to continue doing the good that they are trying to do, because it's ultimately the reward is from the Almighty Allah. Alhamdulillah.
Hawa, I've got Dr. Zafreen Valli here joining us from, she's based in Greenside and has a practice in Greenside. And Dr. Zafreen Valli is part of the Greenside Oxygen Initiative. She's also one of the founding members of Care for You, which is a community outreach. And they Care4You are also sponsoring of hospital beds, wheelchairs, and medical equipment during COVID time, and they've put together, the Greenside Oxygen team have put together a comprehensive holistic support structure. So I just want to welcome Dr. Zafreen Valli. Assalamu alaikum and welcome to Inspired Afternoon, Zafreen.
Walaikum salam. Jazakallah, Mariam, for having the Greenside Oxygen Group on your show. We are truly humbled to be here to be able to help the Ummah and everyone else who's not well. Assalamu alaikum to you, Hawa.
Walaikum salam, Zafreen.
Zafreen, so tell us a little bit more about this Greenside Oxygen Initiative, which is actually commenced. This was formed during the first wave, but I think now, in terms of we have now a term of reference in terms of the COVID and what is needed in that. So this time around, a comprehensive, more holistic support structure has been put in place. So it's not just the oxygen, but you partnered with the Greenside Muslim Women's Group for what Hawa was saying, for the request for soup, as well as the COVID-19 home remedy sunnah packs. There's psychologists, as well as contact details for pharmacists on board, physiotherapists, a biokinetic, and then, as I said, you are one of the founding members and executive of Care4You, and you've partnered with Greenside Oxygen there to loan hospital beds for home care, as well as wheelchairs and other medical equipment, as well as ulama support and bereavement counseling by the ulama in the area. So tell us a little bit more about the initiative.
Okay, so Alhamdulillah, the Greenside Oxygen group, as you rightfully said, has been started off during our first wave, where we said, you know what, we would intervene by helping those patients that require oxygenators. and those patients that needed to have oxygen at home and not necessarily be in hospital, or patients that were discharged from hospital that needed oxygen care at home. During our first wave, alhamdulillah, we managed to maintain that quite well through our team of doctors, our GPs that are on this group. We are quite a few of our GPs from the local, within the Amarantia Greenside area that are part of this community initiative, as well as our group of specialists who are always ready to help with any of the demands and the conditions of our patients. The Greenside Oxygen Initiative, rather, how does this work? The GPs of the patients, it's preferable if they can get into contact with the Greenside committee to apply for the oxygen, for the oxygenators. And then even if they need assistance from our panel of specialists, we are all available to provide full care from the onset of treatment till when the oxygenator comes home or the patient's feeling much better. Now, during the second wave, what we've noticed is that, as Hawa was saying, the need for a lot of people that are not only sick with COVID, but people living alone and are unable to get up and do, the normal chores that they would on a normal day, has become quite demanding in the area. So the Greenside Women's Group, which of course, Miriam, you yourself is part of, as well as the Northcliffe Women's Group in the area as well, have joined and come together under one banner to assist in this venture for all of our areas, I mean, Amarantia, Greenside, and our surrounding areas. Over and above that, even the COVID packs, that's also being done by the Greenside Women's Group, with their capabilities. So under each section, what the Greenside Group has done is that we have affiliated doctors and volunteers and members who are part of the Greenside and Northcliffe groups to take over certain sections, because it can become overwhelming for just a few members to continue with this all the time. So over and above that, we also, like you rightfully said, have physiotherapists on the board. We have biokinetists on the board. We have our local pharmacist, Bilal, who also is helpful, and can do deliveries for medication to all of our sick patients, over and above whatever the doctors may have requested for them to get. As part of helping our patients, we have a lot of people that have passed on. And for these families, there's bereavement counseling as well that can be given via our aliens in the area. And for some of the women, we have APAs also that can be contacted to help with the bereavement process. We have not put out all the numbers on our forms that are, the PDF forms that have been going around on WhatsApp. It's because sometimes, if somebody has a special request, we will take it from there and contact the necessary APAs or Molanas based on who they would like to speak to. From a Care for You Too's perspective, as you know, I am one of the founding members of Care for You Too. We initially deal with special needs children and individuals and their families to a large extent, with a lot of equipment for these children in the form of wheelchairs and walkers and standing frames, etc. But because Care for You Too is also part of a larger group within the country that does medical equipment as well on a larger scale, we've decided to come on board here to help out with any of our sick or illness care for COVID patients that may require additional medical equipment. So that can range from hospital beds to maybe a walker to maybe a commode or a standard wheelchair. Look, if there is a special needs child or a special needs individual that's in this category and they need specialized wheelchairs, then of course Care for You Too will take over that completely. And on the larger scale, with the medical equipment and the remaining of that, we will coincide with the bigger group, and we would try and get the equipment going forward from there. So basically, the most important thing with Greenside Oxygen Group and for oxygenators is that we prefer that the patient's GP contacts one of the GPs on the group or the specialist on the group. We just don't give out oxygenators based on a request from the patient.
And for me, I think coming from a medical perspective, that's important because the patient's GP will have a medical history of the patient, and I think for that reason, you need to verify and speak to your colleagues, and thereafter get. So, look, I think there are many community action initiatives such as this, holistic ones. Hawa will testify, and Roshni as well. They have in all communities and that, but I think we need to know the process. So it's vital that when you need assistance, assistance is there, but we need to know the protocol and how to seek this assistance. Now, as Dr. Zafreen has said, yes, you might have a family member who's now struggling to breathe. They've tested positive, they're struggling to breathe. But look, from the onset, when you go for a positive test, you need your GP's referral letter. So once you have the GP's referral letter, your GP already will get the results that you are positive now. So you need to work with your family practitioner, and then they will then assess. So maybe they might not be aware of a community initiative. You can then make them aware to say, I live in this area and they are providing home-based oxygen care. This is the number, can you contact them? Or they will then tell you, you know what, hospitals are full, this is the process. And then GPs will chat to GPs, and as Hawa said, even for the SUP initiative, yes, there are many volunteers out there. The important thing is let's work within a system here so that you don't duplicate. Logistics are there, and Hawa has said this, let's not duplicate. And Hawa's mantra from ever since I know her, she says unity is strength. That is Hawa's motto that she writes there. So when I think of Hawa, she says unity is strength. And this time here, it's so true that everybody getting together with various specialization and various skills came together, and there's so much strength in. For me, the way we're going to beat this virus is to be united, share resources, share expertise, and together. And although we're physically apart, alhamdulillah, this virus has brought the Muslim Ummah closer together than ever before, because everybody's coming together to provide assistance. So, Hawa, I'd like you to comment on this because you've seen this unity and strength before that's laid before you.
Alhamdulillah, it's so amazing that how people want to give because they're so grateful, I think, to Allah for every day that they are healthy. And that's, when we talk about duplication, it's like this morning, I was just chatting with Sister Shaida Jazba. She's the SANWF KZN wing representative. And she says that there was someone who was offering to make soup for an area in Durban, and they had a banking detail. So I told her, please do get hold of this sister and tell her it's not taking community money and you people are already living in that area. You can rather put your resource together and help in other ways besides soup. Put towards food packs, put towards hampers. Maybe it's a poor family that needs it. So why do people want to work independently, sending out banking account details, and then there's so much of resources. Now suddenly you have money, and then you just making and duplicating, and then people are sitting at homes with too much of. Meanwhile, there's need for bread and milk perhaps in that house. So I that's why I strongly believe unity is strength, because we can build and help reach out more, and also we'll avoid duplication of people sitting together. It's also like with oxygenators that the doctors is talking about. Alhamdulillah, we work closely with the COVID medical team in Roshni. So the thing is that if we can help them to be able to get resources, instead of us duplicating, we can reach out to more people. So likewise, this initiative has been so brilliant that volunteers now assist the coordinators within their area. The very important thing that I emphasize to all volunteers is that, especially when you are doing the delivery, the drop-offs, you have to ensure that you're following COVID protocols. When I'm saying following COVID protocols, is that you need to sanitize before you leave your home, and you ensure how the preparation is done. You need to wear your mask. You need to, when you drop off, preferably leave it at the doorstep. Give a call, say, I've left the parcel out there. You ensure that you sanitize even when you are getting back into your home, wash your hands, everything, and ready to move on. There are protocols that we are educating the volunteers and the people who are preparing the soup just to ensure everybody. And ultimately, then it's in Almighty Allah's hand. We can help, we can provide healing medications, whatever. The rest is to put your trust in Allah, and He sees everybody's intention and everyone does, and He will make everything easy for everyone, inshallah.
I mean, and Hawa, if anybody else listening out there and it's an area perhaps that is not on the list in terms of soup, can they contact you and then you can assist in terms of logistics and coordination, and also in terms of expertise? Like you said, it's one thing to volunteer, but we are in a pandemic, and a very highly contagious pandemic, so we need to take our precautions. When you go, sanitize. I think it's just a drop off, come back, make sure it's sanitized. And I think the other thing is probably put the soup in a bucket, a disposable container, because then that can be disposed of instead of sending a pot. Then you must worry, that pot might have surface infection in there. And then Dr. Zafreen, Valli, from your side, if there's other areas where there are medical teams or medical allied workers that want to follow such initiatives, can they contact the team at Greenside Oxygen, and you will advise them how to start an initiative like this?
Yes, they're most welcome to call any of us, and we will gladly help them set up all the protocols and guidelines as to how about going to do this. And inshallah, just a little note also, which I forgot to say, was the Greenside group also works with ambulance services. So we've been working with Rescue 786, and alhamdulillah, up to date, they've been excellent at what they do. So if there's any other groups out there that would like to see our model, or that are interested, or they would like us to help us with their model, they're welcome to call any of us on the board, and we will gladly help. She went on.
Yeah.
It's time for us to change and break these chains, yeah. Work together to succeed, show them what we can be, yeah. We just need unity. Oh, yeah. All that's good is from Him. That is our own doing. Clear. If you make a mistake, turn to Him and just pray. Pray He cultivates peace, turns our hardship to ease. Respect each other's differences instead of acting ignorant. They want to keep us divided, living under scrutiny. Work together we take pride in building a community. This unity will be our fault. Our reasons for beefing are small. The scheme is we need peace for all. Believe in your dream and stand tall. Believe in your dream. Hey, yeah. United we stand, so divided we fall. Hey, yeah. It's time for us to break these chains. Yeah, yeah. Work together to succeed, show them what we can be. Yeah. We
If you join the new
all that's good is from Him. That is our own doing. Keep intention sincere,
Okay, all right.
and your path will be clear. If you make a mistake, turn to him and just pray. Pray he cultivates peace, turns our hardship to ease. Respect each other's differences.
Okay, then,
They wanna keep us divided, living under scrutiny. Work together and take pride in building community. This unity may be our fault, our reasons for being not small. Humans, we need peace for all. Believe in your dream and stand tall. Believe in your dream.
welcome back. You tuned into Inspired Afternoons. My apology for the internet connectivity. Yes, we are at the mercy of technology. Excellent at sometimes, but then we are at the mercy of technology. So I just like to wrap up by thanking Sister Hawa Patel and acknowledging her, as well as all the sisters that are involved in the initiative, not only the COVID initiative, but always there to give so selflessly of their time and resources whenever there's a need to serve the Muslim Ummah and humanity at large. They so willingly give up their time and resources in that capacity. On behalf of everyone here at Salam Media, your humanitarian journalism online portal, we'd like to thank everybody involved, yourself and everybody involved in this initiative, and we wish you success and strength. And please, this is your platform. If ever we can do anything else further to assist you in terms of getting the message out there or anything else, please, this is your platform.
Jazakallah, and I want to applaud all the sisters out there who in some way contribute and continue contributing towards helping uplift humanity. And I would like to conclude with say, unity is strength, and let's continue enjoying good, inshallah.
Summa Amin, and that was Sister Hawa Patel, who is the chair of the South African National Women's Forum. And I'd also like to thank Sister Zafreen Valli. She also seemed to have a problem with her connectivity, but we'd like to thank them and the entire team of Greenside Oxygen, as well as the IMA with their initiatives in every other initiative that is undertaken by various communities, the community action networks regarding COVID support, because together we will prevail, and it's together that we can fight or stave off the COVID-19 pandemic, inshallah. And for all of you that are isolating and recovering, we wish you a speedy recovery. May the Almighty keep you under His mercy and protection and grant you complete shifa. We are going to go for a short break, and thereafter it's going to be educational insights.